I'm Adriana Bibbo. I'm from Barwon Health, which is University Hospital Geelong, and I'm one of the staff specialist anaesthetists there. I'm here talking with Dr Katie Thorne. She is a geriatrician from Wellington with a special interest in perioperative medicine. Hi Katie.
Thanks for asking me to talk.
Yeah, thank you. Now my first question, and I think it's very important because a lot of anaesthetic clinics are now embedding a geriatrician into their clinic structure. Can you tell me which patients would benefit most from a comprehensive geriatric assessment before surgery?
I think it's a good question given that the number of older adults is increasing and the proportion of them having surgery. And so we need to think about who do we best add value for. So I think older adults who have been identified as frail or who have cognitive impairment, and certainly those who have geriatric syndromes are where geriatricians add the best value to help preempt things like delirium and prevent post-op complications.
Okay, thank you very much. Now, a big topic that has come up a lot and is also one of patients' big concerns is post-operative cognitive dysfunction. Can you tell me, what do you think is important to mention in the consent process?
So I think it's absolutely vital that we think about delirium as one of the most common post-operative complications and know that delirium is not this benign, short-lived muddliness that goes away, that there is post-operative cognitive decline as a risk, which is a permanent change. And I think as part of people making a shared decision, they need to understand that that's a risk and it be acceptable to them. The good thing, as I said in my talk, around a third of delirium can be preventable, and so I think it's just everybody taking the time and seeing it as an investment to make the changes preoperatively so that we can try and prevent some of those post-operative deficits. And it's something that I'm really passionate about, running the rehabilitation ward. I see patients who haven't been consented for delirium and have a post-operative decline that they weren't aware of, which has had a really devastating functional impact. Mm-hmm. So I think it's just really important that we enable patients to make choice, knowing what the risks may be, and modify it where we can.
Thank you. And my final question is, being a geriatrician, what are your key tips to age well?
I think it's such a teachable moment, and it's been really satisfying being part of the perioperative team because pending surgery is such a good motivator for making positive changes. So the things that are good for aging well are also really useful in the perioperative space, and particularly in the preparation time before an operation. So things like eating good nutritious food, particularly high protein, getting some exercise, and particularly strength and balance so that they've got resilience in their balance muscles, and thinking about the medications that they're taking and are they appropriate and adjusting them, and then also just mentally preparing and making sure that they've got good social supports around them for the perioperative journey. But I've seen a few patients who have then made those really positive changes and continue them in their everyday life, such as doing their exercises, it becoming part of their routine, and then they continue them even after their surgery is finished.
It's a great time to have an intervention that will hopefully be continuing on well past surgery.
Yeah, and we always picture in the clinics that what's good for the patient who's sitting in front of them is also probably good for the spouse as well. Yeah. And the more they get a network around them doing those interventions, the more likely they are to continue them.
All right, well, thank you very much for speaking with me. And again, thank you so much for coming here to the ASM.
Thank you so much for inviting me.